So big day tomorrow. The 12s and up can stand in line to get their COVID jabs. Let's get some details on this and other COVID vaccination developments. I'm joined by SA Health Products Regulatory Authority CEO, Dr. Boitumelo Semete Makokotlela. Doctor, thank you so much for your time. I wonder what your message to parents and also the over 12s is about this COVID vaccination for teens.
Sure. So thank you for having me on the show. So as SAHPRA, we have reviewed the safety data of this Pfizer vaccine for those who are 12 years and above, and in this case, 12 to 17. And we are satisfied with the safety profile. Some of the viewers may be aware of some of the very rare adverse events that have been reported in countries that have rolled it out to this younger cohort. And adverse events such as myocarditis has been reported, and we will monitor that in South Africa. And you've also noted that where it has been reported, these have been rare, they've been mild, and in all of the cases, the individuals have recovered from this adverse event.
All right. So if you could give us a couple of numbers in terms of children who've been vaccinated across the globe. I'm not sure if you've got a rough estimate. And then whether you've got any reports at all of children dying after being given the vaccine as a direct result of the vaccine.
I'm not aware of that at this point. And even with adults in South Africa, wherein we are collecting data as SAHPRA, we have looked at all the cases that have been reported. Some of them we're still busy with the causality assessment. However, we can say with confidence that those that we've done the causality assessment for, we haven't seen a direct linkage or association with the COVID vaccine. So they tend to be coincidental. In a number of the cases, we've noticed that the individuals did have COVID, and they then unfortunately lost their lives due to COVID-related complications.
Last night I spoke to Wits vaccinologist Professor Shabir Mahdi about 12-year-olds and up getting the vaccine. He says, why only give one shot? If you're going to do it properly. Give them the 2 doses. I mean, they're giving children in the USA 2 doses, so why not do that here in South Africa?
Yeah, so I mean, we really had to consider this, as SAHPRA. So as SAHPRA, we've authorized it for the use in that cohort. But again, there's other considerations that the Department of Health would have as advised by the Vaccine Ministerial Advisory Committee. And so it is then in those fora where then discussions are held about how many doses to give. And we're of the view that even a single dose at this point will still give the required efficacy and protection then by this vaccine.
So is one dose a recommendation from SAHPRA, and is it a recommendation based on safety, or is it a recommendation just based on practical issues, perhaps other people who might need it before the youngsters?
So as SAHPRA, we have authorized the use of the Pfizer vaccine in the current series for those who are 12 years and older. And what then happens is that then the government needs to then make a decision on do they roll it out in that manner, considering many other factors or not. And so any decision that pertains to a rollout considers a lot more. So as SAHPRA, we would consider the safety, quality, and efficacy. And for a rollout program, there's many other programmatic related considerations.
So just from a SAHPRA point of view, do you have any issues with a 2-dose Pfizer vaccine for the 12s and up?
We do not. And what we would do, like we've done for all the vaccines, there needs to be continuous monitoring of the recipients of the vaccines.
I understand. I want to ask you about the boosters because, you know, there's some are saying actually it's time for the immunocompromised, especially people who only got the 1 J&J, health workers, to start getting the boosters now. Is that your ambit and is it your call to make on when the boosters should be rolled out and who they should be rolled out to?
So again, this is a matter that pertains to both the regulator and, in this case, the Department of Health as they're responsible for that. So from SAHPRA's perspective, what we would consider is then the data that the applicant would provide to us in terms of the efficacy and the effectiveness of a booster shot, we would then authorize that. And how then that gets rolled out would then be the decision that the government would need to make.
I see. So what is your current view on booster shots as SAHPRA?
So we have not received an application as yet to update any of the vaccines for boosters. We've had conversations in this case with, J&J. A number of our listeners are aware of what's happening globally. So we've had a conversation with them. We are expecting a submission of this data. They've shared with us, this initial data they have. We're just waiting for the full submission that we will then consider. But based on what they have provided, we would then be able to make a decision on that.
Explain to us the decision around Sputnik. We understand it's because concerns that giving Sputnik specifically might increase the risk of HIV infection in men. Just give us the official position on SAHPRA and why you said no to Sputnik. And is it a no or a no for now?
Okay, sure. So the Gamaleya Institute has developed two COVID vaccines. So there is the Sputnik V, which has Ad25 and Ad26 and Ad5. So these are the adenovirus vectors that are utilized. And then the Sputnik Light that utilizes only Ad26. So what was submitted to SAHPRA was the Sputnik V vaccine, which has the two components. And the concern that we have is around the Ad5 vector. And the Ad5, this is, a virus that causes general common colds that you would find. So there is some underlying neutralizing antibodies that individuals would have. And when we looked at data around this Ad5, there were studies that were conducted around 2007 or so that indicated that in males, and we saw this largely in males, we still cannot explain it, there's a lot of work going into that. But it was seen that in that cohort, there was increased HIV acquisition in those cohorts of men. And so as SAHPRA, when we reviewed all of that data, our view is that the risk of utilizing this vaccine far outweighs the benefit at this point. What we've said is as soon as the applicant has data that demonstrates the safety of this vaccine in this context, we will consider that as SAHPRA. So we've kept the rolling review open so that when they have data, they can then provide it to us.
All right, thank you so much for that update. Much appreciate your time. That is SA Health Products Regulatory Authority CEO, Dr. Boitumelo Semete Makokotlela.